42, welcome back on this Medical Monday. Many people have the goal of losing weight, but there are many approaches you can take to it. So here to tell us about some of those options, we have Jeannine, who's with Secours surgical specialist. Thank you so much for being in here with us today.
Thank you.
So talk to us. A lot of people think of weight loss and as just diet and exercise here at the end of the day, but when we talk about medical and surgical weight management, how does that factor into everything here?
So lots of things play a role in obesity management. Obesity is a chronic disease. It doesn't go away, but there are very effective treatment options with surgery, with medications, and we take a comprehensive approach. So not just looking at diet and exercise, which are key things, but also medical conditions, genetics, biologic factors, mental health factors play a role, and someone's lifestyle and what are their goals. So we take that whole picture into consideration when we're thinking about medical or surgical treatment options.
Oh, wow. And so then, I mean, for people who do struggle with their weight for years, what is the turning point that makes them kind of consider a program like yours that they go, hey, I've tried all my options, what else do I have?
I will tell you, for every patient, we're not the first stop. All of my patients, I've been doing this over 25 years, have tried a multitude of things, and they know how to diet. So, but it's more to it than that, and oftentimes it's something as simple as now they can't keep up with their kids at the amusement park, or bending over to tie their shoe is difficult, but hopefully they're having discussions with their primary care provider. Maybe they've been diagnosed with diabetes or have sleep apnea or heart problems, joint problems. So lots of factors, but sometimes it's something as simple as I want to go to the park with my kids and now I can't keep up. That's that turning point.
What are some of the options that you guys offer? I know there's bariatric surgery. I mean, I had a friend who did that before. I mean, what are some of the options you give to folks?
So we have a comprehensive program. So we have dietitians on staff, we have a counselor, we have a certified bariatric surgeons, as well as medical team. And taking the whole approach, talking with the patient, getting their individual needs, looking at their history, how can we make recommendations? What would be the best path or treatment option for them? There's always a foundation of diet, exercise, managing our stress, our sleep, all of those things are key. But then there's more to it than that. So surgery is a proven treatment option, and then pharmacologic management, so using medication sometimes, and those things oftentimes go hand in hand. So we're not doing one or the other, and it's kind of meeting the patient where they are, meeting the individual where they are.
So, I mean, there are a lot of myths about bariatric care. I mean, what's one of the things you wish maybe people would know about it that is a real fact about it? So
it's not just about what we eat or how much we move our body. So those factors do play a role. If it was just about that, I wouldn't have a job. So there's so much more to it than that, and so many influencing factors regarding obesity. And obesity is a chronic disease. It doesn't go away. Once we make a fat cell, we're stuck with it. So it's how do we manage that? And it needs to be treated as a chronic disease. So that's why we're there to help. And I wish everyone understood that for sure.
So talk to me about your success stories then. I mean, what are some of the
best
ones?
There's so many of those. So, it's really, everybody has their success and everyone resonates with me in particular. I have patients I've seen for over 20 years. So, but when you have someone who's really struggled even just to get out of their car and walk into the office, coming in a wheelchair, and then now they're able to, you see things, oh, I've done a 5K, or I have a patient that's right now, she's hiking every state park, and going to every state park in the state of Virginia, and that's her goal, is to hike all of those.
Life-changing.
So, life-changing things, just being able to live their life. And they do all the things that they need to do, which is what's really important.
So if I'm watching this segment right now, I'm listening at home, and I go, well, maybe this is the motivation to get me to take the next step to reach out to you all. I mean, how do we start that? How does somebody start that process?
So they can go online to our website at Secours and look up our Weight Management Center. You can call our number, 804-893-8676 is our number. And then hopefully we'll be able to show that too. But we're easy to find, start the process. We've got an online seminar patients can view, looking at medical and surgical options, and then coming in and meet with me. I'm Jeannine. You can come meet with me and talk with me or one of our other providers, and we will come up with a treatment plan that works for you.
Awesome. Jeannine, thank you so much for coming in. It's very important talking about this topic too, because we all struggle with our weight in different ways. So
thank
you so much.
Thank you so much. Thank you.
Time now for a check on the forecast. Here's Khalil.